This time of year is filled with joy, gratitude, and to-do lists that can seem impossibly long. All that multitasking can lead many of us to feeling a bit exhausted. In our Eye on America tonight, Dr. John LaPook has some advice for those of us looking to be more effective in keeping our attention focused on where it should be.
Even though this may look like a perfect example of multitasking, it turns out
there isn't any real multitasking.
Linda Stone coined the phrase for what it really is: continuous partial attention.
We don't ever do anything simultaneously. We are just rapidly task switching.
And how are human beings at doing that?
We're not great at doing it.
She spent her career at Apple and Microsoft, watching how humans interact with tech, which led her to focus on the myth of multitasking.
So what is walking and chewing gum at the same time?
I would call that simple multitasking.
But for more complicated things, research suggests the human brain is simply not wired to multitask efficiently, and people overestimate their ability to do it. A study of doctors found multitasking almost doubled mistakes writing prescriptions.
As a physician, I have to multitask at times, so I can't always just do one thing.
That is how we operate as human beings.
If multitasking is what we do and it leads to more mistakes, maybe when we're doing something especially important, we should remind ourselves to keep one ball in the air at a time.
Stone says our splintered attention causes more damage than we realize.
Where does the smartphone come in?
The smartphone is amazing. There's so many things we can do. And yet, what happens to the body? We hold it, our neck goes down, our posture, we lose it. We lose our ability to breathe properly.
We go step.
Her approach to the mental and physical stress caused by multitasking?
1, 2.
Dancing lessons at a Boston studio with teacher Bjorn Anselm.
We just want to make this feel as comfortable as when we're walking around.
And I brought along my 2 left feet.
So 1, 2, 3.
How does this help me not to multitask?
You can feel that you are working with me. It's not just you, your phone, and earbuds. You're both connected to me, and you're fully present. Your whole body is engaged in this.
Stone says our brains and bodies need to relax with things like walks outside, humming or singing, an antidote to our constantly divided attention.
I can do this with my heels on the floor.
You won't hear any argument from busy working moms Erica Robinson and Evandisa Cabral.
Do you think we live in a world where there is simply too much multitasking?
Yes. Yes, it's like we have to. It's like being a parent. We have to think about what we gotta do for ourselves and what we gotta do for our children, cook, get the clothes ready, make sure they do their homework.
I feel like everyone's brains are always on go. And most times we don't stop to take a breath, even just to breathe for a second.
Living in the moment, a single-tasking prescription for navigating a multitasking world. For Eye on America, Dr. John LaPook, Boston.
Our Eye on America tonight focuses on something felt by many, but discussed by few: loneliness. While 1 in 2 adults say they're lonely, men often have a tougher time dealing with what the Surgeon General now calls a national epidemic. Here's CBS's Mark Strassman.
God gave us a whole lot more testosterone than the other half of the world. We should enjoy it.
This is Everyman, a guys-only weekend getaway in the Berkshires of Massachusetts.
How you doing? Good to see you.
No drinking, no drugs, no phones. Roughly 50 men placing a premium on authenticity, opening up about struggles men often bury, like loneliness.
We can just be raw and real with each other.
We met Brad from Idaho. John's from Connecticut. Dan lives in Maine.
Have any of you struggled with loneliness? Yeah, I would say I'm struggling with it right now.
And what does that loneliness feel like to you?
Maybe fragility or insecurity.
Does it hit you a lot?
It's low-level consistent.
Loneliness is a poverty of the spirit. What about you? loneliness an issue?
I don't resonate with loneliness as much as I do my need for belonging.
Absolutely, I have experienced loneliness in the past.
If you weren't working at it, would loneliness come back to bite you?
I would be back where I was 2 years ago, which is when I'm home, I'm not present.
But it's not just regular guys exploring isolation. From Lenny Kravitz to Joe Rogan to Dwayne Johnson.
I know what it's like to be depressed, loneliness, multitude of things.
Even the most macho celebrities now talk about the richness of vulnerability.
As men, we've traditionally been put in a box and given a very small range to express our emotions.
Everyman co-founder Lucas Crump.
There are a lot of men that are walking around not necessarily overtly a loner, but feeling very lonely.
Loneliness can be rough on a man's health. It carries the same physical risks as smoking up to 15 cigarettes or having 6 alcoholic drinks every day. Think about that and this. Roughly 1 in 7 men say they have no close friendships.
Since we moved to Maine, making really close friends has been strangely hard.
In this crisis of connection, one of the everyman messages, whatever you're feeling, share it.
Hey, I'm having a hard time in my marriage. And that's not something guys usually talk about. So you ask everybody, you're like, who else? And all the hands go up. It's like, oh, I'm not alone.
Their spouses or partners often encourage them to come here.
And there's something about letting our guard down and having fun with other guys that's hard to replace.
It's a lot of work.
Can be.
But it can be fun at the same time.
Absolutely.
Connection. It's like building a fire. Keeping it alive takes work, but the warmth is well worth it.
Is that gonna work?
Oh, yeah. For Eye on America, Mark Strassman in Sheffield, Massachusetts.
A new study finds about 1 in 3 pharmacies have closed in the United States since 2010. From mom and pop independents to big chain drugstores, this trend has a serious impact on healthcare across the country. So in tonight's Eye on America, CBS's Mark Strassman visits a small town drugstore owner who explains her challenges in finding a prescription for success.
Until someone invents time travel, let's prescribe a trip to Kempson Rexall Drugstore. From medicine to milkshakes, a taste of what was in the here and now.
This store means the world to this community.
In Inman, South Carolina, Marianne McElveen's the pharmacist, the owner, the custodian of this presence on Main Street since 1905.
Our customers are extremely loyal. They love us. They love the personal feel that they get, the attention they get.
For Inman's 3,200 residents, the nearest hospital is a half-hour drive away. In family medical moments, big or small, they often call here first.
Get you some of those.
4 generations of Rhonda Glover's family come here every week for something.
Whatever you need, they'll provide it.
Are you worried they could close?
Yeah, it's kind of a hardship.
Like many independent drugstores, this one needs a shot of hope. Prescription reimbursements are falling from insurance companies. Shopping habits are changing. Even the big pharmacy chains are shuttering thousands of stores. Walgreens just reported an $8.6 billion loss last fiscal year.
We've had to make some adjustments, some changes. We've had to cut some hours, just doing anything we can to stay alive and to keep the doors open.
Nerve-wracking?
Yes. There have been many sleepless nights.
Across the U.S., at least 7,000 pharmacies have closed since 2019. Of those, roughly half were independent drugstores.
They're not going to drive 30 miles away to a hospital for a sickness. They're going to go to their pharmacy first.
Professor Laurie Trudell studies small businesses at Clemson University. Are pharmacy deserts becoming a crisis in this country?
Yes, I would say so. I mean, when you think about the thousands of pharmacies in rural communities that are closing, you're losing access to all health care.
In the back end of the store, the pharmacy itself, the profit margin's thin, 3 to 5%.
Especially expensive brand name medications, we fill those and we may not be reimbursed even at our cost for those drugs.
The National Community Pharmacists Association predicted one independent drugstore would close a day during 2024.
What is sad about it?
It's sad to me that that part of America, that part of business would go away. We're not going to throw in the towel. We're in it for the long haul.
But ask any pharmacist, there's no magic pill for that. For Eye on America, Mark Strassman in Inman, South Carolina.
Nearly 75% of adults in the U.S. are overweight or obese. And while a class of drugs known as GLP-1s have been effective in the weight loss battle, out-of-pocket costs put them out of reach for many. In tonight's Eye on America, CBS's Mark Strassman shows us what happened when one state government tried to pitch in to cover its workers.
Hillary Swisher, newly slim, has climbed past a lifelong struggle. She has been big since she was little.
I was trying not to get bigger.
If I show you this person.
Yeah, that's not me. I look at that person now and who I am now, and I don't see me there. And even when this picture was taken, I didn't see me.
Weight loss injectables have exploded in popularity. An estimated 15.5 million Americans have reported using them.
In January, when I took my first shot, my official weight was 236.6.
And you lost how much?
I am down to 170.2. So a total of over 27% of my body weight lost.
West Virginia has America's highest obesity rate, more than 40%, and its second highest rate of prescriptions for these obesity drugs. But without insurance or subsidies, the shots can be wildly unaffordable, especially here in America's third poorest state. In 2020, West Virginia launched a pilot program to subsidize the drugs for public employees. Teachers, city workers, law enforcement officers, all eligible. Swisher qualified for the program through her husband. Her copay, $25 a month. And it worked.
These medicines are absolutely a game changer.
Dr. Laura Davison directs the weight management programs at the West Virginia University Health System. It oversees care for hundreds of patients in this pilot program.
They never really realized how much their body was fighting them with weight loss until they had a tool that helped that.
This class of medications, called GLP-1s, can cost more than $1,000 a month out of pocket. In March, the state insurance agency funding the West Virginia program announced it was over. Not enough supply and too expensive. A painful pause for people like Lori Osborne. Experts say it's a mistake. All states pay eventually for obesity's complications.
Had I known then what I know now, I don't think I would have done it.
Because it was false hope.
Because it's false hope and it's so hard on you emotionally.
Osborne has lost 70 pounds and 6 sizes in her clothes.
Even with the coupon, I think Wegovy's $6.50 a month. That would feed my family for almost a month.
How does it make you feel?
Mostly, I am just mad.
And the thought of going back to where you were?
It is so depressing. It is just demoralizing.
Osborne has now turned to a non-FDA approved discounted version of the drug from out of state.
This is all of the medication I have left.
Swisher started rationing her remaining medication. She takes a shot every 2 weeks instead of 1.
Every time I take a shot, I calculate in my head how much I have left.
The supply will eventually run out.
Oh, absolutely.
And that
terrifies me. I don't know what's going to happen.
Swisher says it feels cruel. She's suddenly craving hope. For Eye on America, Mark Strassman in Morgantown, West Virginia.
There's a multi-million-dollar effort underway to bring more African-American doctors into hospitals and examination rooms nationwide. That effort is focused on easing the burden of medical school costs for students at historically Black institutions. In tonight's Eye on America, CBS's Jerika Duncan shows us how more Black doctors can lead to a healthier country.
You are doing amazing.
40-year-old Dontel Johnson dreamed of becoming a doctor as a child.
Did you
see any black doctors? Did you know any black doctors?
I had never seen a black doctor growing up, and one of the crazier things is I never saw a black doctor until I hit college.
Johnson decided to apply to medical schools in Texas, but when a friend told him about a potential school in Nashville, Tennessee, full of black students, he was in shock.
I told him he was a liar. I said this place didn't exist. I went home that night.
What did he tell you that you really thought it didn't exist?
He started describing a place of people that looked like me, that were dentists, doctors, scientists. So I went home that night. It was still, I had dial-up internet, so I had to wait for it to pop up. And then these photo stills came across of Meharry, and I applied that night at maybe like 1 or 2 a.m.
Johnson graduated from Meharry Medical College. He decided to stay in the community and is now a pediatrician and a professor there.
I think one of the things that's really coming to light, that patient population of African Americans and how systemic racism, how history, how the healthcare profession overall has not always been there for this patient population.
A population that has better overall health outcomes when treated by black doctors, according to recent studies. To further those connections, this past August, former New York City Mayor Michael Bloomberg announced a $600 million gift to all 4 HBCU medical schools. Combined, they have educated roughly 50% of all black doctors in the United States. Currently, African Americans make up about 14% of the population, but represent a little more than 5% of doctors.
Having a healthcare professional is important in the community, but also having a black healthcare professional raises all the boats.
Dr. Valerie Montgomery Rice is president of Morehouse School of Medicine in Atlanta. How does that uplift everyone?
First of all, it's going to allow us to educate and train more black and brown physicians, and it's going to allow those students to have more choice in where they want to practice and to be less burdened with debt.
And that's something she's already seen. In 2020, Bloomberg gifted Morehouse School of Medicine $26 million to help students pay down debt. Resident physician Jamil Joyner received $100,000.
It not only says we believe in black doctors, it says we believe in black institutions and how they will play a role in changing healthcare for black individuals.
For Dr. Dontel Johnson, more investment in black doctors is needed.
I'm a living witness of that, of training up African American physicians that cater and care for the underserved. So when you look at the data together and say that, hey, when we partner with African American physicians and we put them in communities, we actually see less strokes, we see less hypertension in the community, we see less obesity.
Healthier communities, a healthier nation. For Eye on America, Jerika Duncan, Nashville, Tennessee.
This week marks the start of Lung Cancer Awareness Month, and while rates have been declining for decades, it's still the deadliest form of cancer. Each year, more people die of lung cancer than of colon, breast, and prostate cancers combined. Researchers have recently noticed an alarming rise in diagnoses among non-smoking Asian American women. In tonight's Eye on America, CBS's Elizabeth Cook examines this troubling trend.
For 5 years, Vicki Nee has been battling lung cancer, a diagnosis that came out of the blue after she went to a doctor for pain in her shoulder.
He was taking x-rays of my neck, and it was only by chance that the bottom corner of the x-ray showed a raised diaphragm.
What were you thinking when they said you have lung cancer?
I was stunned beyond words.
The 54-year-old lawyer and mother of 2 is now part of a medical mystery. Lung cancer in non-smoking adult Asian Americans had been rising an average of 2% a year for more than a decade before Nee received her diagnosis.
I assumed that I would get chemo and beat it. It was only later when I met with an oncologist that I learned that I was stage 4 and therefore incurable.
A study by leading California medical centers found that 57% of Asian women diagnosed with lung cancer are non-smokers. For all others, only 15% of the women diagnosed had no history of smoking.
You didn't grow up in an area that there was a lot of air pollution?
No.
You weren't exposed to any cancer-causing chemicals?
Not to my knowledge.
And as a non-smoker, she wasn't eligible to be screened for lung cancer.
Currently, screening guidelines drive what's covered under insurance.
Scarlett Gomez and Iona Chang, epidemiologists at the University of California, San Francisco, were awarded a nearly $12.5 million grant from the National Cancer Institute.
So some of the factors we're looking at include certainly exposure to secondhand smoke. High exposure to cooking oil fumes is an established risk factor.
And why Asian American women specifically? Why not Asian men? Is there a hormonal component to this?
There is some suggestion based on cellular studies just in the past year showing that a particular genetic mutation may predispose people to being more vulnerable to levels of air pollution.
At the heart of the mystery is the fact that we are all breathing the same air. But why are women like Vicky Nee getting sick while others are not?
We always wondered, is there something that we can do to diagnose them earlier?
At New York University's Perlmutter Cancer Center, Dr. Elaine Shum is randomly screening 1,000 Asian women for free.
We are definitely going to need a much larger study to really provide the evidence to try to change the guidelines one day so that other populations can be offered low-dose CT scans by insurance companies.
Detection that will come too late for Vicky Nee and her husband David to prevent advanced cancer.
Like any cancer, it affects the whole family. Yeah, I'm sorry.
But could offer hope to spare other families that same pain. For Eye in America, I'm Elizabeth Cook in San Francisco.
One in 8 new mothers in the U.S. suffers from postpartum depression, according to the CDC. Even more alarming, 3/4 of them go undiagnosed or untreated. In tonight's Eye in America, Nikki Batiste takes us inside a new facility that offers a new approach for postpartum mothers and explains why it's still out of reach for so many.
It's a big jump going from 1 to 2, isn't it? It is. It is.
For Catherine Schiefer, who gave birth to Owen 5 months ago,
You taking good care of your mama?
motherhood the second time around has felt drastically different. Her daughter Cora is 2.
Yeah, a little anxious. Did experience rage this morning. Like, it's not something that feels comfortable for me. So
scary.
Yeah, scary.
The 35-year-old lawyer was recently diagnosed with postpartum depression after her husband John encouraged her to get help.
I had the thought, in the middle of the night, like, I don't want to be here. And when I say not be here, I mean on this earth. Like, it was
Suicidal thoughts.
Yeah. I mean, I know my kids need me, and I love them, and I want to be here for them. So to have thoughts like that were alarming. It was alarming.
Raw and powerful, Catherine's thoughts are shared by so many new mothers. Suicide is one of the leading causes of death in a woman's first year postpartum.
I think it's destigmatizing that we don't just have to have one feeling of joy, but that becoming a parent can also have a great deal of grief and loss for a life that you used to have.
Dr. Sarah Orrick, a reproductive psychiatrist, says most insurance policies don't come close to meeting the demand for mothers in need of mental health help.
Reimbursement for mental health care in this country is abysmal to the point where there's mostly people working out of network.
Ask new mom and former social worker Delindra Buys.
There's so many moms that could utilize so many different services, but they can't because they can't afford it.
After she was diagnosed with postpartum depression, she wanted to come here.
He loves the water.
To Fourth Try Sanctuary outside Detroit, where doulas take care of babies so moms can shower or nap. But she couldn't afford it. The founders rely on donations to provide care for some women, like Delindra Buys, for free.
It breaks my heart to hear him cry.
Catherine comes here too, but she pays out of pocket, and it's pricey.
Exhale, you're in charge.
There are also yoga classes, lactation consultants, and mental health support groups, bringing a new dimension of postpartum care. It is much needed relief for 32-year-old Delindra. She and her husband Eric turned to IVF after struggling with infertility. Their son Cassius was born at 26 weeks, weighing just 2.5 pounds.
The guilt was the hardest thing and still is the hardest thing.
How would you describe postpartum depression?
A hurricane, chaos, mayhem, a storm.
Where would you say you are today in the storm, in the hurricane?
It's not raining as heavy.
And other moms have come up to me and whispered to me, it does get better.
Mama. With every conversation, those whispers grow louder, helping the stigma and shame around postpartum fade away. For Eye on America, I'm Nikki Batiste in Ferndale, Michigan.
In part 2 of our Eye on America examination of the addiction crisis, we are looking at harm reduction programs. This is a controversial approach to treating addicts that critics say only make things worse. CBS's Mark Strassman reports from a community that has fully embraced it.
An Indian is an Indian, a brother is a brother, a sister is a sister.
Twice a week, Coleman Cox drives more than an hour into controversy.
30 shorts.
30 shorts. Today we are headed to Veneta, Oklahoma.
It's called harm reduction. Its focus, preventing drug overdoses and the spread of infectious diseases rather than urging abstinence.
Across the board, this 7,000 square mile reservation, no one's immune.
Chuck Hoskin is the principal chief here with roughly 140,000 tribal members.
There's something that's especially sad, even pathetic about this, isn't there?
No one sets out to really get addicted to anything, but so many people were using this medicine because it was prescribed to them.
America's opioid scourge is a special sorrow here on the reservation. In 2022, more than 100,000 Americans died from overdoses. Native Americans are twice as likely to overdose fatally as white Americans. Cox and Chris Rich set up their van in an alley and waited for people with addictions to show up.
We have sterile syringes, we call them points.
Points are needles, clean ones for people using.
This is the controversy.
It can be, yes.
Harm reduction programs have also been tried in dozens of communities. In several states, needle exchange programs were disbanded. Critics complained they encouraged homelessness.
It's easy to be unsuccessful because it tends to be just blanket approaches.
Cassie Abbott-Eng has researched harm reduction programs at the University of Tulsa.
Is this an approach born of desperation?
I would agree with that.
We met Donald Cody in Veneta. Now 61, he has struggled with addiction since he was 17.
I'm so tired of doing the same old thing and expecting something different to happen.
What do you think of the van program?
People are going to do what they're going to do, and that way they have the safest way they can.
So we were talking about the Cox, now in recovery himself, agrees. When people say to you, you're just enabling users.
I am enabling them. I'm enabling them to live tomorrow. All my enabling leads to them eventually making the decision to change their relationship with their drugs. And then we can begin to talk about treatment and recovery.
As a tribe, the Cherokee fought opioids by suing multiple drug makers and pharmacy chains. They've won more than $100 million. Some of that money funds this harm reduction program.
I learned a Cherokee word today.
Oh, you did?
Gadugi.
Gadugi, working together as a community, as a tribe.
And that's what this program is?
But it's also Uwe Shua Donatela, which means the ones who help from the heart.
This drum circle celebrates Cherokees trying to stay clean and sober. Handing out clean needles is sobering, but nothing else has worked. For Eye on America, Mark Strassman in Tahlequah, Oklahoma.